Well, you've probably heard the saying, the eyes are a window to the soul. But it turns out they could also be a window to our physical health. King 5's Christine Pei spoke with a UW surgeon and engineer about tracking tears in this week's all-new HealthLink.
Tears, whether they're from joy or sadness, can show us how we're feeling. But a new research project out of the University of Washington is looking beyond that.
So I wear a few hats.
Dr. Tong Shen is an eye surgeon at the UW Eye Institute at Harborview and director of UW's Kren engineering-based medicine initiative. She has a background in engineering research related to medicine, which came quite handy when she delved into a concept, using biosensors to monitor tears.
So the tear films are very similar to any other body fluids like saliva, sweat, or blood, right? So these are all very basic body fluids that has a lot of information in them.
It's a concept Dr. Shen says has been in the works since the early 2000s when scientists studied tears to monitor blood sugar levels. She and her team are now looking into a biosensor device so small it can fit inside a human's tear duct.
It's very tiny, so it's less than a millimeter in diameter.
And packed inside this tiny device is a system that uses artificial intelligence to analyze data from certain molecules that can tell us about glucose levels, even inflammation.
And there are biomarkers that can have implications for Alzheimer's disease or Parkinson's or neurodegenerative diseases. It could be early biosensors for cancer.
Still in its proof of concept phase, the device would work similarly to something called a punctal plug, which is commonly used to treat dry eyes for patients who reported such plugs are well tolerated.
Any device on the eye has to be very small if you want it to stay sort of non-invasive.
Shen does note some limitations to tear tracking this way.
The level of those molecules and those concentrations are low, so that's one major barrier.
But our big picture vision for this biosensor is on course.
And this is where engineering, AI, robotics in combination of medicine could actually put us on the map in terms of leading the future of transformation. So that's where I'm very excited about.
For HealthLink, I'm Christine Pei.